Hello, this is Dr. Brian McDonough, and what I want to do is give you an insight into how we record Coronavirus Today, the audio podcast. Now, here's the deal. Coronavirus Today on video is more or less being phased out as we start to do our reports staying healthy together. We're going to be looking at all areas of health, but certainly COVID needs a great deal of attention. So I'm not abandoning the initial project we started so many months ago, over a year, which is Coronavirus Today, which was an audio podcast designed to talk about all things COVID. The need for that continues. But what I'm realizing is as I moved Coronavirus Today into a video format, recorded over 125 video reports, that it really is not necessary to keep talking in such great detail in the video world. You can always hear the audio podcast. So what we're about to do is to essentially simulcast the very last Coronavirus Today video with a continuing Coronavirus Today podcast. So I'm about to start recording the Coronavirus Today podcast, which is for April 3rd. Hello, I'm Dr. Brian McDonough, and welcome to Coronavirus Today, the podcast. Coronavirus Today, the podcast, is for April 3rd, which is a Saturday, 2021. Right now, as we look at it, we realize in the world there are 130,408,506 cases. In the United States, 30,615,517 cases. As far as deaths, sadly in the world, there are 2,840,548. And in the United States, we have now had 554,181 people die as a result of COVID. There is some interesting news. Some of it actually comes from Israel, where 55% of the population has been vaccinated. Now remember, here in the United States, we're at roughly a third. We're over 100 million, which is an incredible achievement, but we clearly have to do better. But what we have seen in Israel is that with 55% of people vaccinated, and with serious attention paid to wearing masks and social distancing and trying not to have spread, what we have actually seen is that in Israel, the number of cases of mutant strains and other strains has dramatically gone down. In other words, the virus spread is slowing down there dramatically. That gives us insight into what we can do here in the United States if we hold tight and continue to do what we're doing. Now, on the heels of that, there are some positive things that are happening to indicate that we can move forward. For instance, the CDC has just made recommendations, and I'll actually quote the CDC. Basically, they're saying fully vaccinated people can travel at low risk to themselves, but travel still isn't recommended at this time because rising numbers of coronavirus cases continue in this country. But the CDC said as long as coronavirus precautions are taken, including mask wearing, fully vaccinated people, once again, let me stress that, fully vaccinated people can travel in the United States without getting tested for COVID-19 or self-quarantining thereafter. If you are not vaccinated, I cannot stress this enough, you are at still as great risk as you were at the beginning of the pandemic. In other words, right now, if you have not been vaccinated, you have the same death rate, the same illness risks, all those issues that someone who has been fully vaccinated no longer has to deal with. So I encourage you, when the time comes, and it's rapidly happening around the country, take advantage of being vaccinated. Because ultimately, when you're not vaccinated, you're kind of out of the conversation. You're just going to have to deal with things as they come. Because remember, right now, people are being told to wear masks, to social distance, and to take precautions. So if you've been fully vaccinated, you're doing this out of courtesy to others. But there's going to come a point, ethically, where you can just say, well, people have made their choices, and that's fine, but now they have to live with the ramifications. As a physician, I do not want to see you living with the ramifications of not being vaccinated because I know what happens. So if you've been holding off, waiting to see if it's safe, waiting to see if there's problems, I suggest it might be time to think about getting vaccinated. If you've been holding off for political reasons, I cannot challenge your political views. If you believe that for some reason this is all a plot, I cannot argue against that. That's a personal view you have, but I just want you to know that you have to live with the consequences of that view. You're in a situation much like if you were in a society where nobody got vaccinated. This being said, going forward, there is some hope, even if you haven't been vaccinated, because We hope that as more people are vaccinated, the virus slows down and the spread slows down, as it should. We know that from the way viruses have acted in the past. So, a lot of stuff to unwrap in this coronavirus today. For those of you who are watching the last video of coronavirus today, I've already told you we're moving forward with coronavirus today only in the podcast format. We're going to continue with that as long as needed. We have over 75,000 listeners, and this is really important to all of you I know who listen. We will have coronavirus today as long as is necessary. But for video, I am moving in the YouTube and social media world into other health issues, because what I'm realizing is the more we ignore other things, the more problems we are going to have, and we have to move forward. Another major focus, and I want to stress this, is because it's social media and you can do these things, which is great, I am encouraging everyone to listen. This is all inclusive. One thing I have learned from this virus is that we are all in health together, and that if one of us is sick, all of us are sick. Again, keep washing your hands. For those on the audio side, we'll continue. Those on the video side, start following Staying Healthy together.